Well, I'll go ahead and get started so we don't hold everybody up. Good morning. How was y'all last night shift?
It was good. Okay.
Any hot spots we need to pay attention to? Like any high-risk falls?
Originally, when I started here in orthopedics, I came in as a part-time nurse because I did not know if I was gonna like it.
Can you disconnect 62 for me so I can medicate 56?
By the time I made it through my orientation, I realized that this was a place that I wanted to be. My name is Daliyah Alexander. I am a registered nurse on the orthopedic floor.
I love working with Daliyah. She's always very cheerful.
Daliyah is happy and creative. One of those people that knows everybody.
I just always have fun when she's at work.
She loves what she does and she's anxious to know and anxious to learn. She's always looking for opportunities to do better.
Good morning. Oh, Dr. Park was just here?
Right.
What did he say?
It took longer to take the pins out than it did to do the surgery.
You know, because they were there for ever.
Yeah.
Mr. Hagan, his story is a little unique. He had pins placed in his hip when he was about 10 years old. Now he has a whole brand new hip.
It was like walking with a cane, and I don't know whether I'll be able to maneuver this morning or not. I get up and go to the restroom. But now, I'm 69, so I couldn't go any longer without trying or making an attempt to have somewhat of a better life.
So the plan for him is just pain control and to progress with physical therapy.
He is doing exceptionally well, as though we would expect for most patients to do after having had a hip replacement. He's up, moving around. He's able to get up and sit in the chair and have his meals. He's an ideal orthopedic patient.
So we have your bisoprolol, that's for your blood pressure.
So I am orienting Lauren. She is a new graduate nurse.
We always pair them with another veteran nurse to kind of get the hang of the unit, to get the basics down, to kind of get them past that graduate status.
So another thing that I do in the morning is
Daliyah is one of my two preceptors. She came on to me and was so excited to meet me, which for me, I knew off the bat, okay, this is gonna be great.
Lauren is doing exceptionally well. I have to keep up with her most of the time. In the morning, Lauren and I will make rounds on all the patients that we are assigned to. Our patients are there because usually they're having an elective surgery, but we do have those cases where grandma fell and broke her hip, unfortunately. These are joints and bones that we're working with that have been fixed, and the only way to rehab these patients is to get them moving.
We want to make sure that the patients are safe to go home, so we need to educate them on precautions, hip precautions if they have any, spine precautions, any precautions the doctor deemed necessary for them to go home.
Physical therapy is a huge aspect of orthopedics.
Easiest way to do this, you're going to advance your walker first, your surgical leg, then your good leg. So walker, surgical leg, good leg.
This might be their first time up after surgery and they're navigating what it's like to walk with a new knee, a new hip, a new anything, a new piece of hardware in their body.
They report back to the nurse and just let the nurse know how the patient did and how we can move forward with either possibly sending this patient home, or if they need more skilled help, we can send them to a skilled nursing facility. Keeping a patient's pain controlled is a huge part of being an orthopedic nurse because, as anyone may know, if you are in pain, you don't perform at your best. That can be a challenge because I'm not only taking care of one patient, I'm taking care of 4 to 5 patients that are all in pain. So just making sure that I am aware of the pain schedule and also that the patient is aware of the pain schedule and what's expected of them.
What I like the most about training with Daliyah is she likes to have fun.
Without no clothes. Your feet doing like this.
I do laugh a lot.
It's hard. It's all in you.
She's really good at smiling through everything, laughing through everything.
So that's not the right answer. So you would actually look
The
right.
thing that I like most about working on Done 70s is the fact that I feel like it's my home away from home. My coworkers, it's a true blessing to be able to call them family and for us to be able to laugh with each other and just make something that is so serious enjoyable. One of my goals is to proceed and get my master's in science nursing directed towards education. I really have a passion for what I do. I've been in healthcare for, I say longer than I can remember, just being that my mother was ill growing up and I did take care of her. I just want to be able to give back to the next generation, so hopefully we can develop more nurses to be at the bedside with patients when they need it the most.